Hello everyone, myself Dr. Samrat Madnai. I am a consultant cardiac anesthesiologist working at KIMS Karad. Today we will see how to give a USG guided popliteal sciatic nerve block. As an anesthesiologist, we often come across patients who require surgeries of the lower limb, foot and ankle surgeries, below knee amputations, or arterial embolectomies in the lower limb, especially the popliteal embolectomies. In the current COVID era, many times we get patients who have active COVID infection or are in the immediate post COVID phase. These patients are at high risk for general anesthesia. Also, most of these patients are on anticoagulants and hence central neuraxial blocks, especially spinal and epidural, are contraindicated in them. Peripheral nerve blocks, especially sciatic nerve block, is an excellent modality of anesthesia in such patients. The indications of sciatic nerve block include foot and ankle surgeries, below knee amputations, and analgesia following knee surgery involving the posterior compartment. Popliteal embolectomies can be very well performed under this kind of block. Before moving on to the block, let us have a brief overview of the sciatic nerve anatomy and its course. The sciatic nerve is a major nerve of the lower limb. It is a thick, flat band approximately 2 centimeters wide. It is the largest nerve in the body. The sciatic nerve supplies sensation to the skin of the foot as well as that of the entire lower leg except for its inner side. It provides motor innervation to the hamstring muscles, posterior, lateral, and anterior compartment of the leg, foot, and ankle. But remember, it spares the medial aspect of the leg, which is supplied by the saphenous nerve. The sciatic nerve gives rise to two components. First is the tibial component, and second is the common peroneal component. Remember, the anatomy and the course of sciatic nerve in the popliteal fossa is variable. Similarly, the bifurcation of the sciatic nerve into tibial and common peroneal components is at variable distance from the popliteal fossa. Traditional landmark techniques require large volumes of local anesthetic. Because of these reasons, the success rate of the sciatic nerve block with the traditional landmark technique or PNS guided techniques is very low. USG helps us to understand and identify the bifurcation of the sciatic nerve. The aim is to inject the local anesthetic in the nerve sheath surrounding the sciatic nerve, which is also called as Broca's sheath, just at the level of division. In the picture, which is on the right side of your screen, you can see I have marked the sciatic nerve. Now, the marking of the sciatic nerve is approximate and it's just for the purpose of understanding. You can see the popliteal crease or the popliteal fossa is at this level. The bifurcation of the sciatic nerve into the common peroneal and the tibial components is usually at 5 centimeters proximally to the popliteal crease, but this distance can be variable. With the USG, our aim is to identify this site of bifurcation, the site where the sciatic nerve bifurcates into the tibial component and the common peroneal component, and inject our local anesthetic solution at this level, at the level of bifurcation. So, how do you position a patient for USG guided popliteal sciatic nerve block? So, there are two approaches for the popliteal sciatic nerve block. The lateral approach with the patient lying in supine position, the lateral approach with the patient lying in lateral position, or the posterior approach with the patient lying in prone position. The lateral approach with the patient lying in supine or lateral position is the most commonly used. But remember, the comfort of the patient is important during performance of this block. And this block can be effectively performed with the patient lying in prone position also. Now, once we have seen how to position the patient for popliteal sciatic nerve block, let us see how the probe is positioned during this block. We require a high frequency linear probe to perform this popliteal sciatic nerve block. If the sciatic nerve is to be blocked at the subgluteal region, that is at the higher region, we require a curvilinear probe because the nerve lies at a greater depth at the subgluteal region. Now we start by placing the high frequency linear probe in the transversely over the popliteal crease. The aim here is to identify the popliteal artery, the vein, and a bright color structure, which is usually the tibial component of the sciatic nerve. After identifying this, what we do is we move the probe 5 centimeters proximally to the popliteal crease, and the aim here will be to identify the bifurcation of the sciatic nerve into common peroneal and tibial components. Understanding the basic USG anatomy is very essential to successfully perform the popliteal sciatic nerve block. Now, once you put your linear probe transversely across the popliteal crease, you'll be able to identify a few structures. The structures are popliteal artery, popliteal vein, and sciatic nerve. You can make use of the Doppler profile, color Doppler profile for identifying these structures. So the pulsating structure which you will be able to appreciate after applying the color Doppler profile will be popliteal artery. Just above it will be a compressible structure which is non-pulsating, which is the popliteal vein. And above that you will be able to appreciate a grape-like structure which is bright, and it is the sciatic nerve. Now the sciatic nerve at this point is divided into two components, the common peroneal nerve and the tibial nerve. Medial to these components are the semimembranous and the semitendinosus muscles, while laterally lies the biceps femoris muscle. Now from this point you need to advance your probe more proximally from the popliteal crease till these two structures, that is the tibial nerve and the common peroneal nerve, join together to form the sciatic nerve. This site where the sciatic nerve divides into tibial nerve and common peroneal nerve is the site where you need to inject your local anesthetic for the successful performance of this USG guided popliteal sciatic nerve block. Now, once you are able to successfully identify the division of sciatic nerve into tibial and common peroneal components, the next step includes advancement of your needle towards the sciatic nerve where it is branching. Now, this can be done by two techniques. The first is in-plane approach and second is the out-of-plane approach. I usually prefer the in-plane approach. The advantage of the in-plane approach is the needle tip is visualized along its entire length and entire course till it is directed towards the sciatic nerve. The disadvantage is it has to traverse through the muscle and is more painful to the patient. Some people also perform this block by the out of plane approach. In out of plane approach, the needle tip is not visualized and you need more expertise. But the advantage is the needle has to traverse very less distance and it is less painful to the patient. Now, once you identify the sciatic nerve, what you need to do is you take your entry point 2 centimeters lateral to the tip of your probe and direct your needle from laterally towards the sciatic nerve, traversing the biceps femoris muscle. Now, important is you have to always visualize the tip of your needle. Once you are in desired plane, once you reach the sciatic nerve, next step is injection of the local anesthetic. Now, usually I inject 1 to 2 ml of bolus local anesthetic injection once I reach my desired site. We have to make sure that it is not an intraneuronal injection. So for this, if there is resistance while injecting this 1 or 2 ml of local anesthetic, I usually withdraw my needle tip and reposition it. If you are using a peripheral nerve stimulator, then make sure the motor twitches at the ankle and the foot are not seen beyond 0.3 milliamperes of your current. Once the position of the needle tip is confirmed, then usually you can inject the full amount of your local anesthetic, which is usually around 20 to 25 ml of local anesthetic solution. This block can be performed with the use of blocks with adrenaline and bupivacaine, which I use commonly. Once this injection of local anesthetic is complete, just scan the proximal and the distal area to see the spread of the local anesthetic in the neural sheath or the nerve sheath, and you will be able to appreciate it after proper scanning. Now, after knowing the basics of ultrasound anatomy to perform the USG guided popliteal sciatic nerve block, let us take a look at a real time block which is being performed. Now here the patient is lying in lateral position and the block is being performed by the lateral approach with the patient lying in lateral position. Now as you can see here, the probe is placed proximally to the popliteal crease, almost about 5 centimeters. The division of the sciatic nerve into common peroneal and tibial components is identified with the help of this high frequency linear USG probe, and that is the site from where your needle will have the entry point. Now the needle entry point is usually 2 to 3 centimeters lateral to the tip of your probe. This technique which is being seen here is in plane approach, where the tip of the needle is continuously visualized under the ultrasound probe. Sometimes during this technique, you need to tilt your probe, ultrasound probe, more caudally so as to visualize the sciatic nerve in a better way. Now here on screen you can see the needle is being directed towards a bright structure which is the sciatic nerve on screen. Now once you place your probe at the popliteal crease in the popliteal fossa, you should be able to appreciate a bright colored grape-like structure which is the sciatic nerve, which has two components, the lateral component which is the common peroneal component and the medial component which is the tibial nerve. Lateral to the structure lies the biceps femoris tendon. Medial to this structure lies the semimembranosus and the semitendinosus muscles. Now, as you move your probe more proximally, you will be able to appreciate a single structure. These two structures combining together and joining to form a single structure, which is the sciatic nerve. And as you move your probe more laterally, that is towards the popliteal crease, this sciatic nerve divides into common peroneal and tibial components. You can also make use of color Doppler to identify the popliteal artery and the popliteal vein and the sciatic nerve. The pulsating structure is the popliteal artery. Just on top of it lies the popliteal vein, which is a compressible structure, and the bright color structure above it is the sciatic nerve. Now, after identifying the site of sciatic nerve, the site of bifurcation of the sciatic nerve into its two components, next step includes advancement of your needle. As I said earlier, the needle is advanced 2 centimeters laterally to the probe and is directed towards the sciatic nerve. This technique is in plane approach. So you can see here the needle tip is being advanced under vision and is being tried to direct towards the sciatic nerve. Now the needle is passing through the biceps femoris muscle and has reached the perineural sheath now. Now once inside the sciatic nerve, you can inject 1 or 2 ml of local anesthetic solution to check whether there is any resistance and whether the local anesthetic solution is spreading inside the perineural sheath. Once this initial bolus dose is complete, you can inject the rest of your local anesthetic solution, which is around 20 to 25 ml. Make sure the tip of the needle is visualized throughout the procedure. Sometimes you might need to make fine adjustments and then inject the remaining amount of solution of the local anesthetic. Now, post injection of the local anesthetic, just scan the entire area of the sciatic nerve and you will be able to appreciate the spread of the local anesthetic solution along the nerve sheath of these two components as seen in this image. So this completes your basic orientation for performing an USG guided popliteal sciatic nerve block. What I'd like to tell you is understand the basic USG anatomy before performing any block. Before initiation of any block, always analyze the structures that you see on screen. Initially, a couple of times you might find it difficult to perform the block, especially with the orientation of the needle and the advancement of the needle. But with practice, you should be able to improvise on your skills. If you have any queries, you can mail me on my email ID, which is given below, samratmadnaik@gmail.com. Thank you, and regards from Department of Cardiac Anesthesia and Department of CVTS, Krishna Institute of Medical Sciences, deemed to be University, Karad. Thank you.